the talk, this first of the three, is really more of an overview of where we are with our understanding about the impact of emotional health in JM, juvenile myositis. So I have no relevant financial relationships to disclose, and I just put up some of my current funding for you to see. But really what I'm hoping to go over in this talk, this very brief talk, is thinking about, well, how common are emotional health problems for patients with juvenile myositis? And how might these problems be related to having juvenile myositis? And then how can we begin to think about addressing emotional health problems? So we know, I think each of you in this room knows that juvenile myositis is a challenging disease. We know that it involves muscle inflammation, causing weakness and fatigue and pain. It involves skin rashes, things like calcinosis, and it involves a whole multitude of other things depending on the individual. But in general, this collection of diseases requires intense treatment, and where we have to deal with medication side effects. It's a chronic condition. It's not a 2-week thing. It's usually over several years. And within that, even when the disease gets under control, there's a possibility of flare. And then just the sheer amount of care that goes into our juvenile myositis patients, it's a lot. There's many doctors, there's many visits, there's many tests. So overall, it's a stressful thing. And we can think about how this might impact emotional health for patients and families. And I just wanted to put up here some quotes from the Department of Health and Human Services, the leading health initiatives. The recognition of the impact of emotional health is becoming more and more apparent, and this is a good thing. So these are some statements that are produced by the Department of Health and Human Services. So the first is that mental health or emotional health is essential to a person's well-being, health, family, and interpersonal relationships, and the ability to live a full and productive life. I think most of us would agree with that, and probably most of us knew that already. But what's also very interesting is that they take the step beyond to have another statement that really ties this to physical health. So they're saying that mental health or emotional health has a serious impact on physical health, and is associated with the prevalence, so how common these conditions are, the progression of the disease, and the outcome of some of today's most chronic diseases. And I think this is the context with which we need to think about emotional health in relationship to the physical health and the social health. So zeroing in on juvenile myositis, how common are emotional health problems? Well, I can say that this fund of knowledge in terms of emotional health for juvenile myositis is not very rich yet, so we have some work to do. But let me show you a little bit about what we do know. So one thing, taking a step back, thinking about quality of life, which encompasses mental health, physical health, and social health, we know that this is important. So there was actually a survey study done by Dr. Heather Torrey within the CARA, or Childhood Arthritis and Rheumatology Research Alliance work group. And they wanted people to rank on a survey 19 aspects related to the quality of juvenile myositis care. And so the top 5 that they came up with their survey results were overall quality of life, timely diagnosis, access to rheumatology, normalization of functioning and strength, and then ability for self-care. But what was interesting was they broke this down by patients and families on the left, and then healthcare professionals on the right. And even though overall quality of life definitely shows up in the top 5 for both of those groups, you can see it's number 1 for patients and families. So that really is an indicator that this is really important and perhaps needs to be a little bit more recognized for importance among the healthcare professional group. So what about specific studies that have looked at psychosocial health? Well, this is sort of an older study that was done looking at juvenile dermatomyositis patients and quality of life. And they found that basically quality of life scores for juvenile dermatomyositis patients compared to healthy children fell below those of healthy children, specifically for some of the psychosocial aspects. So these included emotional and behavioral and social limitations, family activities, and bodily pain. So we're getting closer to thinking about the psychosocial impact. So very recently, within the last year and a half, the CARA work group on mental health did a survey which included juvenile dermatomyositis patients and parents, or juvenile myositis patients and parents, I should say. And this survey more specifically asked about depression, anxiety, and other emotional health problems. So we found that 1 in 3 of the survey respondents, of the patients, said that they were having or had had at some point depression symptoms. 1 in 2 really reported anxiety symptoms, and 1 in 4 had had difficulty coping with adjustment to illness. These are high numbers. This is a lot of the sample. Now, mind you, it's not representative of everybody, but this is sort of one of the biggest samples that we've surveyed, that has been surveyed, focused on emotional health. And I should also say that there wasn't much difference between what the patients reported and what the parents reported. So the other thing that we found in this survey is that a lot of these symptoms had been recognized by the patients and parents who had answered the survey, but many of them said that these disorders had not really been diagnosed. So in the orange bars, or maybe they look brown to you, I'm not sure from where you're sitting, report what the proportion of respondents were that reported depression, anxiety, and a bunch of things listed there that were clinician diagnosed. In addition, in the blue, there were people that said we had these self-reported symptoms, but they hadn't necessarily been diagnosed by a clinician. So this gives us a clue that, maybe we're not really recognizing these symptoms very well. Maybe we really need to think about what to do to improve the recognition and thus addressing these emotional problems that are coming up for our patients. So thinking about, how are these problems that we're finding, that we're seeing, at least in this sample, how are they related to having juvenile myositis? So you can think about many things that could be contributing to some emotional challenges for patients. Things like limitations we talked about, physical, social, family, academic, pain, stigma of having juvenile myositis, whether it's a visible rash or whether it's a feeling of having something that's very rare and not very well understood and feeling like you're sort of standing out invisibly due to that. The burden of managing a chronic disease, all the medications and the complex care, which we mentioned. Just the uncertainty of, what does this new diagnosis mean? What does this mean long term? Am I going to flare? Am I not going to flare? What am I going to do? We know that there is a link, there's beginning to be understood to be a link between inflammation and emotional health or brain health, and also the impact of parent and caregiver well-being, and things like heritability, sort of your genetic risk for having things like depression and anxiety. So all of these things can contribute. But when we ask specifically about factors related to juvenile myositis, again, in that survey that we did, we found that 7 things really came out on top. So in the blue bars are what patients reported, in the orange or brown bars are what the parents reported, and 3 is the highest rating. So these, again, were the most highly rated things. And while there were some differences, as you can see, between patients and parents, really what came out on top was worrying about a flare, the overall stress on the family, changes in appearance, whether it be due to rashes, calcinosis, or medications like steroids, physical limitations compared to peers, worrying overall about the future, limits on outdoor activities, and this was an interesting one, feeling like they were growing up too fast. So these are things that really might not come out in the typical screens or surveys that are done to assess depression and anxiety. These are things that can be thought about uniquely in a way in relationship to having a juvenile myositis. So we've begun to do some work on thinking about how common emotional health problems are, what might be the risk factors, or what might be the aspects of juvenile myositis that are contributing. We've done much less work on how this affects outcomes or how this affects the future of patients and families. And I put this up here just to think about, what kind of domains would we think about when we're thinking about outcomes and how to look at this as we do our work going forward. So we think about is emotional health related to control of juvenile myositis? So if you recall that statement from the Department of Health and Human Services, we think that there's a link between the actual physical health and outcome and the emotional health. How about things like utilization of healthcare, so emergency room utilization, hospitalizations? All of these things have been linked to emotional health in other populations. The ability to transition well to adult care can be impacted by emotional health. We talked about relationship to health-related quality of life, but also things like school performance, work productivity, peer and later on family relationships as well. So these are all things that are yet to be explored in the context of juvenile myositis, but definitely need to be. So moving on to think about, well, how can we address some of these challenges that we're beginning to learn about? So I think there's three main areas that we can think about this in. One is education about emotional health, so raising awareness with patients, families, parents, and then also, I didn't put up here, but also all the clinicians that take care of juvenile myositis patients. It's really imperative that they're aware of the emotional health challenges that our patients and families have. And then moving towards better identification of patients and family members who are experiencing emotional health challenges. And then finally, getting people the intervention. And there's several things that will be talked about by Dr. Manning in particular, I think. Different interventions for emotional health problems. So the work in this area is very early, as is our understanding of emotional health in JM, but there is work being done. So the first part of thinking about how to address problems is sort of like the needs assessment phase, sort of where are we, what are we doing already, what's already happening. So our CARA group did some work looking at this, and we surveyed CARA sites, or pediatric rheumatology sites, representing about 90% of the sites in North America. And the bad news is that only about a third of those sites really said that those rheumatology centers had a social worker or psychologist. Unfortunately, this wasn't totally surprising, but I think it's important to really recognize where we are so that we can recognize where we need to go. And when we asked the rheumatologists at these sites what they thought in terms of how we were doing, so about 50% said that we could really do a better job identifying depression and anxiety symptoms. Luckily, the overwhelming majority, were really in support of things like routine screening as a potential way to better recognize emotional health problems. But really, only 2% of these sites had anything really in place. So this is sobering to think about this. And that even when we recognized a problem, that a lot of the rheumatologists thought that we weren't really doing a great job, whether it was out of their control. There's many different factors that go into this, but we weren't really doing a great job of connecting the patients or the families to the services. So this indicates there's a lot of work to do. So then we asked behavioral health providers, so social workers and psychologists that were affiliated with these rheumatology sites, because they sort of had the best knowledge of what was going on, what they thought needed to happen. So we already had asked the rheumatologists, they said, yes, there's a problem. Then we asked the behavioral health providers, well, what can we do? So they really identified sort of 5 overall things. Better intervention, so this means screening and therapy strategies for depression and anxiety, recognizing that anxiety is a big challenge for a lot of our patients. Also thinking about illness-related coping interventions, so we didn't want that to be left by the wayside, and they recognize this as a very important thing. Another thing that they thought was lacking was paying attention to parent and caregiver coping in distress. Another area they thought needed special attention was mental health support during the time of transition to adult care, and in general, peer support programs for patients and caregivers alike. So when we ask different parties, okay, it seems like there's a problem. We have ideas for what needs to happen. So what's standing in the way? So things that were mentioned as barriers, so the rheumatologist said, well, we don't have a lot of time, we don't have a lot of staff, and we know that we don't have a lot of access to mental health providers. So these are all things that need to be worked on. And when we asked the behavioral health providers, they said, well, because they're already there, so they're ready to go because they're already at the sites they're at. They said, you know what, we could really benefit from like a more integrated policy or protocol. So sort of almost like a task force to tell us and to make it very clear to the rheumatology team and the clinics and sites, this is what we need to do for mental health. And then along with that, really fully utilizing all of the personnel that can be utilized for mental health services, such as social workers. And then when we asked the patients and parents these same kinds of questions, what was very interesting is that, sure, there were long wait times to see mental health providers, and we know that, and it can be difficult talking to a stranger. But what came through really clearly was this first point about the need for people who are helping with emotional health to really understand juvenile myositis as a disease. And I think this relates back to the fact that there are very specific aspects of juvenile myositis that are impacting emotional health. So this was very, very enlightening to get these three perspectives. And while this seems, dampening, sort of stressful, daunting, I think these are the real first steps towards making progress. So I would urge everybody in this room, when it comes to thinking about emotional health, and if you are encountering any challenges or problems, which is highly likely actually, to really advocate and to really take a sort of participatory role. Because I think the patient and family voice is very powerful. And if you have a need that's not being addressed, the best thing that you can do is make it very apparent to your care team that you have a need that's not being addressed. Because I'll tell you that at the institutional or the hospital level, they want to know what you think. They're very interested in knowing what needs are not being met. So I just want you to know that your voice has power. So in summary, youth with juvenile myositis are at risk for emotional health problems, and these problems can negatively impact physical and social well-being. But education about emotional health and screening for emotional health problems will help us better recognize and address emotional health challenges, and that there are interventions for these problems, and there's work ongoing that you will hear about from Dr. Ardalan and Dr. Manning, that there are resources and services that can help, and that we need to make these or get these to be more accessible for patients and families. Thank you.